This thing will see if this thing stops circling. Hey, everybody, Dr. J here, DC Foot Doctor, doing a surprise live Q&A. Thank you for joining. We have one here. Hey, Allison, glad you could join me here today. So we're just going to talk a little bit about foot care. We're going to talk about how the channel's been doing. And we're going to answer some questions. We'll be here for about half an hour to about 5:30 or so Eastern Standard Time in the United States. Again, my name is Dr. Kevin Jefferson, podiatrist in Washington, D.C., USA, nation's capital. Big up to everybody here in the DMV. Good to see some people coming in. Good to see y'all. We're just going to chit-chat a little bit, bring you up to speed with what's happening, what we're going to do for the channel, and then how the channel's been coming along. I see you folks are coming in. I see Brandy 1525. She's a great subscriber. She does a lot of comments. Thank you for joining, Brandy. So everybody's coming in. Oh, look at these names coming in. My wife Terry's here doing some moderating.
Hello, everyone.
And if you can't tell, I'm here in my office space here in Washington, D.C. on Georgia Avenue in Northwest. If you're in the area, if you ever find yourself in uptown D.C. on the Silver Spring border, come on by and pay a little visit. We could do some foot care or just chit chat, chew the fat a little bit. I want to thank you all for supporting the channel. And as you can see behind me, the Silver Play Button Award, we reached 100,000 subscribers a couple of weeks ago, or actually about a month ago, I guess. So thank you all for your support. Thank you for all your questions and watching the videos and, encouraging me and what we do here, and encouraging my patients as far as sharing their stories and sharing their experiences. Especially want to thank my wife, because she does a lot, but most really behind the scenes stuff that keeps the channel going. Just a little bit about me again. Here in Washington, D.C., nation's capital, United States. I've been practicing now 21 years. Went to podiatry school in New York City, New York College of Podiatric Medicine, and did my training, postgraduate training at the Brooklyn Hospital Center in Brooklyn, New York. And I did a foot surgery fellowship at the same hospital. So I started practice in 1999, and I've been going ever since. This channel was actually started a little over 3 years ago, but I really wasn't into it a lot until my wife really helped kick it off about a year ago. So the real growth of this channel is really in the last year, thanks to my wife Terry, and then all you good people out there who've been watching and and really keeping this thing going. So thank you very much. I really want to thank the patients, because it's not that easy for anyone to share their issues, what they've been going through, especially on camera. Even though the vast majority don't have their faces or any other identifiers in the video, it's still kind of tough for them to share their stories. So I want to really thank them for participating and really being the driving force behind the channel. So again, I'm going to be here till about 5:30 or so Eastern Standard Time. So I'm going to start fielding some questions and see what we have. Let's see. No questions yet? Okay. All right. So we have a lot of common questions in the channel, especially about how things come to be and how I handle certain situations. A lot of the channel has to deal with basically all the type of things that we see in foot care. In podiatry here in the United States, it differs from how foot care and podiatry is done in other parts of the world. Like here in the United States, podiatrists are considered physicians, doctors. So that's why I'm Dr. Kevin Jefferson. In other places, they may be, like Canada, they may be considered chiropodists. So a lot of foot specialists in Canada are not considered doctors, but they have a lot of the same training. Although they may not be able to do surgery, they may not be allowed to do wound care and things like that. They still provide the vast majority of foot care in their home countries. Another thing you may notice is that I get a lot of comments on on my demeanor, on my style, on my techniques. And like in anything else, everybody has their own way of doing things. The way I do things may be different from the way a podiatrist down the street or across town or in California or in Canada or in Europe or Africa may do things. We all have our druthers, we have our certain types of training we received. We have things in our hands that we like that work better in our hands versus working in someone else's hands. So there's really no right or wrong way to approach a given situation when it comes to foot care. It depends on what's comfortable for that doctor. It depends on what his or her training is and what their experience has been in order to help deal with a certain foot issue. So if you see me do things different from the way other doctors do things or other chiropodists do things or the foot specialists around the world, if you see me using a different piece of equipment than what some other doctor uses, that doesn't mean that one's better than the other. It just means that we're doing things that are comfortable for us to help achieve a goal of making our patients better. Let's see. Some other things that we deal with in DC is that some people will wonder why the vast majority of my patients are African American. That's because in DC, the vast majority of citizens are African American, especially this part of DC in Northwest on Georgia Avenue where my office lies. Most people like to go to the doctor closer to home versus closer to work or anywhere else unless they need to really see a certain type of specialist. So the vast majority of patients that I see, that you see on my channel, are African American or Caribbean. But we do get patients from all over the world. We get all stripes, all walks of life that come through here. But again, the vast majority, because of the demographics here in the area, are African American. Some things that we're starting to show more on the channel is my passion for wound care. Wound care, particularly diabetic foot care and wound care, is very important, especially now since the incidence of diabetes is increasing in the United States and across the world, and the need for specialized wound care in the lower extremity is very important. People need to understand, particularly our diabetics out there, need to understand that podiatry is the place to go for your foot care. Podiatry is the place to go if you start to developing wounds. You don't want to do things at home that you may harm yourself. You may not want to go to non-medical professionals for your foot care, and unless the doctor decides that you're in good enough shape and position to go to salons and other places like that to get your feet dolled up and what have you. But you're going to see a lot more wound care from me in the future. You're going to see some other things. We're going to be kicking off a learning series soon. Well, I will be talking about things that you can do at home to deal with certain foot issues. Going to give you, some step-by-step things that you can follow, answer some questions about how folks can deal with their foot issues. I got a lot of people reaching out to me, email and through Instagram and Facebook asking questions. I just also want to mention to you the super chats that are available during YouTube lives. Super chats allow you to have your question or your comment bumped up to the front, if you will, or to the top, so we don't miss it. You can give a monetary amount to whatever you feel like, and those are always appreciated. So that'll help you move your question. If you really have something that you want to ask or get off your chest, go ahead and hit that super chat, and we'll go from there. All right. Let's see.
You ready for some questions?
Sure. Go ahead. Who you got first?
Okay. So, and sorry, I'm not going in any order, but okay. So someone, Kenzie Francis says, I have gout in both feet. Now that the feet have gone down, they are peeling a lot. What should I do?
Well, with gout, you can expect there to be a lot of swelling, a lot of redness, a lot of inflammation, and that causes these skin.
See you later.
That causes the skin to swell along with the feet, and as the feet begin to go back down toward normal size, the skin doesn't always keep up, so you'll get that peeling. It's kind of like this a snake molting, the skin coming off of a snake, because the skin doesn't keep up with the change in size of the foot. So what you want to do in that case is gently use a washcloth or something similar, or maybe something a little bit more abrasive, but not sharp, to work that skin down after you've been in the shower, after you've been in the bathtub. Use emollients or lotions. You guys who follow me know how I feel about shea butter. Shea butter is great to help re-moisturize that skin and help get that turgor back in the skin and make the good skin good and healthy. It'll take some time for that to come back to normal, but as the swelling gets more in control from the gout attacks and that skin begins to tighten up as the swelling goes down, you will see that peeling go away.
Okay.
Yeah. Oh, 50 chat, 5 super chat. Thank you very much.
Okay, man. Yeah. So someone else wants to know really quick. So
Thank you, Logan.
Have you ever turned any patients away? That's from Jeremy Cox.
I've never turned any patients away. Sometimes you'll get situations where folks will call and there will be insurance issues, whether we don't take their insurance or what have you. But we always give them the opportunity to either pay out of pocket or some way have some other type of source to help deal with that issue. But I've never turned anybody away. There's nothing about foot care that scares me or said things I can't help them. Now, if there are situations where I need to refer them out to other specialists or what have you, then I would do that when there's either vascular surgeons, oncologists, or whatever need to be brought in to deal with this particular issue. But I've never turned anybody away just because of the health issue.
Okay. And so Logan Fields said he gave a $5.
Yeah, I saw that. Thank you, Logan.
Thank you, Logan. He says, hello, Dr. Foot Doctor, Mr. Foot Doctor. Love your show. You should come to Denver. You're well liked here, and you've made me take care of my feet much better.
Yeah, Logan, thank you very much. I spent some time in Denver. I was stationed for about a month, 6 weeks when I was in the Army at Fitzsimmons Army Medical Center in Wart, right in your backyard. So we love Denver, and hopefully I'll get up there. But when travel gets better in the country, maybe catch a little snow, maybe a little skiing in the area.
Okay. All right. Cool. Yes, we love to ski.
Mm-hmm.
Also, Casey wants to know, can calluses be removed?
Mm-hmm. Well, calluses can be removed. They can be what we call pared, P-A-R-E-D, which is another word for shaving them down on a regular basis. But the thing about dealing with calluses or corns or any rough skin issues is always dealing with the root cause of why they're there. So if the root cause is never addressed, the calluses will always come back. So you have to deal with that either through orthotics, regular care, moisturization, better shoes, maybe an adjustment of shoe size, activity level, and what have you. But footwear, foot care, and regular skin care can help calluses to go away.
Okay. And Dream wants to know, what do you think about those foot peeling or mask kits? Those foot peeling masks.
Okay, peeling kits. It depends on what you are dealing with. If it's just a general dry skin, there are other less aggressive ways to deal with dry skin. If the issue is, say, if it's athlete's foot or what we call tinea pedis, then that's not the cure for it at all. Athlete's foot, fungal infections need antifungals. You need to identify what the skin issue is before you decide to do any treatment, whether it's a fungal infection, whether it's eczema, or anything else. So once you determine, or once you have a doctor help determine what your foot issue is, then you can go to the various options that you have. I'm not a big fan of chemical peels of the foot, especially because we have to walk on our feet. You know, doing a chemical peel of the face is different from doing other parts of the body. Brand new me, thank you for the super chat, $4.99. Thank you very much for support.
Okay. So I was trying to see if they have a question, but I didn't see a question. Okay.
Mm-hmm.
We have so many. So and then this one lady says, I do not have high sugar, but I have had calluses on my feet that I cannot get rid of, and I take great care of my feet. So since watching your channel, I check my feet and my father's feet every week. So
excellent.
Thank you for that.
Thank you.
And another person, Donna Powers, wants to know, what could be the cause of numbness in the feet?
Numbness can be from a number of things, whether it be diabetes or other what we call systemic conditions that affect the nerves. It could be issues with the lower back, particularly with the spine, the vertebrae, and what's the word I'm looking for? And the vertebrae, how the spine is aligned, particularly if you have numbness in your feet with particular positions that you're in. Sometimes we'll see people have that issue when they're lying or sitting in certain positions. We got another question from Deborah, who also sent a super chat. Thank you very much. Deborah Steins says, I've been having burning in my feet, usually when sleeping. It will wake me up. My feet feel so hot. What could this be? And is there a remedy? Burning of the feet is, again, is a nerve issue, is a symptom of a nerve problem. So what you need to evaluate is, always start with the lower back, because most of the time, when there's nerve issues with the feet, if it's not diabetes or something else that's systemic, most of the time it's a problem with the lower back. The nerves that go down to the feet start in the nerve roots of the lower back, go down the legs and continue to branch and get smaller until they get to the ends of the toes. So unless there's a nerve entrapment issue in the ankle or somewhere else, or an injury, things like burning of the feet, itching, numbness, tingling, things like that will cause this issue. So start with evaluation of your lower back and go from there. Thank you very much. We got a $20 super chat from Lara Hook. Thank you very much. She asked, do you always keep up with each of your patients? And she says, also, because of you, I make sure my mom's foot care is good. Thank you, Lara, for the super chat. Again, the purpose of this channel is to educate people about foot care for themselves and for their loved ones. And so Lara's statement is particularly why I do what we do with a lot of us in podiatry who are on YouTube. Why we do what we do is promote the profession and to promote good foot care for ourselves and for our loved ones. Thank you very much. So do I always keep up with each of our patients? Yes, ma'am. Most of them come on a regular basis, every 3 months. And then those we haven't seen in a while, we have ways of getting in touch with them, especially through all the different avenues we have now, not just phone, but we have email, all the social media and things like that. So it's much easier these days to keep up with folks, even folks we haven't seen in a long time.
And Regis Smith wants to know, I also gave you a $10 donation. Thank you, Regis Smith. I've been watching for a while. Thanks for your show, and everyone with great healthcare looks like showing with great healthcare.
Oh, thank you, Regis. Thank you very much for the super chat. Yeah, again, this is what it's about. I want to make people understand that foot care is health care. You know, a lot of problems in other parts of the body may manifest in the foot, or, you know, like the old folks say, when your foot hurts, when your feet hurt, everything hurts. So, you know, that's why we do what we do. Keep supporting Regis, keep looking out. Thanks a lot. Got another okay, Deborah Stein, another super set. She's going at it. Thank you, Deborah.
She said, yes, I do have back and hip problems and broke my right ankle in 2014. Thank you, Dr. Shea.
Yeah, with a history of back and hip issues, whether it be a traumatic issue like a fracture, or whether it be a slip disc or anything like that with the cartilage, have that checked out, get it evaluated. Make sure you see, you start with your primary physician and see an orthopedist or a neurologist, someone who can check that back out, a chiropractor, and see what the issues are that's leading to those foot symptoms.
Okay, so we have a lot of questions. So I'm moving back up the line. Sorry if I'm skipping over you, but I'm trying.
I got to give a shout out to Queen Z Queen, a sweet E. She's Sigma Gamma Rho Queen. Our daughter's a member of Sigma Gamma Rho Beta Chapter. Shout out to her, from you to you. Thank you very much for supporting the channel. 06 to you, sis.
Okay, so Jennifer Stewart wants to know, what should you put in the water to soak feet before you treat them?
What we do, water is the best medicine on earth. It treats just about every issue, whether it be from cancer to thirst to dry skin. Water is a very important part of what we do. And most of the time in this office, in the water, basically what we use is something to keep the water sanitary. So we use either a Whirlpool solution or betadine if a person's not allergic to iodine, something like that. But to do, like at home, if you want to soak your feet, What I like to tell people to use is a mild soap, like for those who are old enough to remember Palm Olive or Dove soap and things of that nature that are not uh, don't have a lot of perfumes. Things like that will do fine. Epsom salt has its place, but Epsom salt can dry the skin, so I don't recommend Epsom salt for every situation. But things like that will go a long way to help keep the skin healthy. All right, we've got some more super chats coming in. Let me click on those real quick. Karen Kerwan, thank you for the super chat. Have you experimented with wart removal? I injected 2 stubborn deep ones with tea tree and oregano oil, and they disappeared and have not returned. Fantastic. Essential oils have anti-inflammatory properties, which is why that worked for you. There's a whole lot of different ways to deal with warts, what we call plantar warts of the feet. Most of the time they occur in the soles of the feet and maybe the ends and the tips of the toes. They are also very common in the palms of the hands. So there's a whole lot of things from freezing to acids to laser to surgically just removing them and to the different type of injections that you talked about. There are some medications used for to deal with stomach issues like cimetidine. Doctors have used to help deal with warts. So there's no one answer for every person. There's no cookbook answer for this issue or any issue for that matter. So your experience is very good. Now, if it's what we call mosaic warts, where there's a lot of warts all over, you might need something like that you can use topically, because you can't freeze the entire sole of a foot. And we have seen where the entire ball of the foot or all 5 toes, something like that, may have warts on them, maybe one large wart and a bunch of satellite warts. So we do see that.
Okay. And Christina Mackey wants to know if heel spurs are treatable.
Heel spurs are very treatable. First, all heel pain is not a heel spur. A heel spur is bone that's grown forward from the bottom of the heel or going upward from the back of the heel. And most people who have a heel spur don't have heel pain. Now, you can have plantar fasciitis, where the plantar fascia is deep to the spur, which is having a soft tissue reaction to what's going on, to what caused the spur to begin with. Plantar fasciitis is very treatable. You have to have patience. You have to have time. Sometimes you have to try multiple therapies or change therapies if something's not working. Sometimes we have to send folks out to physical therapy to do some physical therapy modalities to help with it. But plantar fasciitis, heel spurs are very treatable.
There's a lot of comments. And let's see, we got people from Brazil,
of
course, and Spain, and the Bahamas, and Utah.
Worldwide.
And Evan wants to know, did you expect the channel to blow up like it did?
Actually, the whole thing was a surprise. The whole thing, when I first started restarted over a year ago, was to again talk about foot care, use it to help get the name out there for myself and the practice, and it just took off. It took off because of you guys. You guys were the impetus to keep it going. So again, I can't do this without you guys, and certainly can't do it without the patients participating. So that's how that happened. We got another super chat from Cynthia Walker. Thank you, Cynthia. She says she has prosthetics on the inside of both knees. When my knees hurt, I get foot cramps. Should I see my knee doctor or my podiatrist or this? And the answer is yes. The answer is both. Start with the knees. All right, see what's going on with your prosthetics. Sounds like you may have had a total knee replacement, perhaps. If you're having issues with that, especially if you've had the implants 5-10 years ago, there may have been an issue with the implant. So you want to go back to your surgeon or surgical team that put them in and get them reevaluated to see if there's any issues with that. Your podiatrist will help you with this, because it sounds like you're getting some compensatory issues, some compensation, and your feet need to be addressed, and orthotics can help with this knee issue, maybe even prevent you from needing further knee surgery. So definitely start with your surgeon who did your knee surgeries, and then go to the podiatrist after that, who can work along with your orthopedist to help remedy this situation.
You got another super chat from Camille Jones, and she says, I am a hairstylist headed back to work.
Mhm.
Any suggestions on great shoes for support, comfort, and style? She says she used to wear heels to work.
Mhm.
So, yeah.
All right. So again, with COVID-19, a lot of folks in that line of work in the cosmetics industry, whether it be facial or hair, barbershops. I don't know if you guys saw me a few months ago when I had my Rona fro, but yeah, it can be tough. So wearing heels all day can be very detrimental on your feet, especially the balls of your feet, and then the Achilles tendon in the back can get tight over time. So what I would recommend for you, it depends on how things are in your shop and how everybody else's dresses. If there's a dress code that you all adhere to, that may help determine, what type of shoes you wear. But you want to wear something more casual, a little on the flatter side that can accommodate an insole or a thought, something that's more accommodating than hard and stiff. You want to wear something that's like a foam or a gel type of device to go on your shoes, particularly with support in the ball, the arch, and the heel. That will help you, especially if you're working on your feet all day. Most hairstylists do stand up when they're working with their customers. And if you're working 8+ hours a day, it will take a toll. So definitely start with your shoes, start with the right fit. Start with the right fit of your shoes. Then have the shoes fit your position, what you're doing for your work, and a good incall.
What about Crocs and stuff like that?
Crocs, again, it depends on the foot type. All right, Crocs are pretty generic as far as what the type of foot that works with them. Crocs may work for some folks. I've had some people that swear by them, and I have some people who can't stand them. It all depends on their foot type, how the Croc fits. I haven't seen too many narrow Crocs. So folks with narrow foot type, you may have a harder time with Crocs. There, you may want to get an insole that will fit into the Croc and go from there. So orthotics or insoles, yes, ma'am.
Yes, I love those.
Mm-hmm.
Cynthia Walker got another super chat from her. She
Oh,
says,
thank you.
I have prosthetics on in inside of both knees.
Yeah, we talked to her about that. Yeah, we got that one.
Okay.
Yes, thanks again, Cynthia.
Okay, so there's a lot of people. So here's someone from Albuquerque, New Mexico.
All right.
It says, Tristan Klein.
Mm-hmm.
Dr. Jefferson, I live in Albuquerque, New Mexico. I
All right.
also have cerebral palsy.
Mm-hmm.
I'm not even sure if this is relevant to my question
Mm-hmm.
or not, but how can I tell whether I have a corner callus versus a regular pain?
Well, corner callus will be very visible in the skin. Corns, of course, occur across the tops of the toes. Calluses, the ends of the toes or the bottom of the feet. It will be visible. If you can't see your feet physically yourself because of your cerebral palsy, you need to have someone take a look. The corns will be hard, thick, maybe whitish, yellowish, or dark over the joints, over the knuckles of the toes, if you will. Calluses will be on the bottom of the feet or in the tips of the toes, or maybe the side of the big toe. With cerebral palsy, you get a lot of spasticity in the toes and in the forefoot. And so that will create high pressure areas, especially rubbing against shoes. So you want to start with making sure your shoes are fitting you well. You may need to get prescription shoes, or what we could call shoes, extra depth shoes, but will accommodate the toe deformities which you may have. And so just regular pain is different from corns or calluses. Corns or calluses will have a different change in color and shape and thickness of the skin over the pressure areas.
Okay. And I just have one. Oh, Nancy Pataja. I hope I said your name right, Nancy. But she says, I love your kindness towards all of your elderly patients. And when you rub the feet down, of course, with the shea butter.
Right.
But then she also asks about plantar fasciitis and what can be done with that.
Well, again, plantar fasciitis, get into the root cause. Is it flat-footed? Is it high arch foot? Is it related to your job, what you do every day? There's no one fix for it. For some people it's injections. For some people it's orthotics. For some people it's oral medications. For some people it's physical therapy, either at home or at a physical therapist office. And most of the time, it's a combination of any of those. Again, there's no one thing, there's no magic bullet. When we deal with plantar fasciitis, which is something that we do deal with just about every day in our practice, we have to take a holistic approach, look at the patient completely. It's not just a foot issue. It could be a body weight issue. It could be, again, an activity issue. It could be related to sports, running. It could be related to whatever you do, whatever your occupation may be. So there's no one answer for dealing with plantar fasciitis. I will be doing a learning series on plantar fasciitis soon, so look out for that. I talk about that more in depth. But if you're having a problem, especially if you had it for a long time, you definitely need to see a podiatrist sooner than later. Most plantar fasciitis will eventually go away with the right treatment, but there are some cases that we call recalcitrant, which is just doesn't go. So we have to do things that are a little more aggressive, sometimes even all the way to surgery. Got another live chat, another super chat here.
Okay, and yeah, Laura wants to know, can you do a top 5 couple?
Well, we're actually, thank you, Laura. Thank you for that. We're actually in the process of, my wife and I, we're in the process of doing a top 10 compilation. So look out for that for, in recognition of the 100,000 subscribers, where they're going to do a top 10 pretty soon. I'll let you know when that happens. Follow me on social media at DC Foot Doctor, so you can find out ahead of time.
And Emily also wants to know, who takes care of your feet?
I do for the most. I take care of my feet for the most part. I'm pretty good at it.
He stays moisturized.
Yeah, I say y'all know I drive moisturization into my patients' heads. So it starts with me. You got to be your first client. So I do my feet for the most part.
Yeah, we make our own shea butter.
Yeah.
Okay. Yes. All right. And,
I'm seeing one from Valencia E. Has been up here for a minute. She writes, I have lymphedema that causes major swelling in my feet. My skin is very dry. Should I see a podiatrist regularly? And what do you suggest for moisturizing? Yes, Valencia, we do see lymphedema quite often. You know, we're podiatrists and just not foot care experts. We're experts of the entire lower extremity. So these chronic swelling issues can create issues with the skin, dryness, cracks in the skin, fissures, things of that nature. So you definitely want to see a podiatrist on a regular basis. Sometimes folks who have lymphedema, it's difficult for them to care for their feet themselves because you just can't get the feet in position for you to deal with them. So seeing a podiatrist regularly will definitely help you out. Again, remedies for dry skin issues varies from patient to patient. I don't recommend things like Vaseline or baby oil, things that are purely petroleum based, because things that are purely petroleum based don't moisturize. All they do is grease and work as a barrier for the skin. That's why Vaseline and things like chapstick are not great for lips, but terrible for your elbows and knees because they're not really moisturizing. So you're going to want to use something that's water based, creams, okay. Lotions, emollients like shea butter. You can mix some oil-based things like essential oils, your tea tree, lavender, jojoba, things like that, things that we mix into our shea butter here. And that will help. You may have to experiment a little bit. You may have to try something for a little while and then see if it's helping you out and then go on to something else. There's a lot of trial and error with skincare because, again, what worked for one person may not work for you. So you're going to want to try things for a little while. There's no quick fix for skin issues, including dry skin. So don't try it for a couple of days and give up. So you want to keep trying things for at least a couple of weeks, 2, 3, 4 weeks, see how it's coming for you. Okay. All right. Got another, I'm sorry. We got another super chat. LB Calkins. LB's been following me since the beginning, and she makes a lot of comments. So I want to thank you, LB, for your support of the channel. It says, good afternoon, Dr. and Mrs. Jefferson. By the way, Mrs. Jefferson is also Dr. Jefferson. She has her doctorate in education in EDD. So she's out there. What I'm doing for the feet, she's doing for the kids. So in their education. So she's also Dr. Jefferson. She says, I try not to miss any of your sessions. I've learned so much for my own self-care. Thank you. No, LB, thank you. Without you guys, this is not possible. So thank you for continuing to support the channel and look for more great things to come.
And so I want to get Warrior Queen Mother out the way. She asks, she says, I have a dorsal bunion that bothers me on and off. And I've had it for about 10 years. Is it worth having it removed?
It depends on surgery. Depends on how painful it is, how difficult it is for you to wear shoes. And I never recommend surgery as a first treatment for elective issues. Elective means it's not an emergency. It's not an urgent situation. It could be bothersome, but it's not a requirement for you to function. Now, if you're having pain and difficulty, surgery is an option for you. There are other things that you can do, such as, again, extra depth shoes, padding, and things of that nature. But if it's really bothersome for you, surgery is definitely an option. I have a video about a dorsal bunion. The name of the video, if you haven't seen it already, is called "What is this bump?" About something like that. I think that's what it's called. So look that up, and I go through the surgery for that particular problem. Krista Jones, thank you for the super chat. Her question is, do you have your own line of shea butter? And we do, but right now we're in the development stage as far as finding a way to mass produce it and distribute it. With things that are going on with the pandemic now, a lot of that's been slowed down. So we are able to make enough to support what we're doing here in the office. But right now, we're not in a position to have it mass produced to get out to across the country and across the world. But that is part of our short-term planning. So continue to look out for that. Again, thank you for that super chat. 10 more minutes? Okay.
Okay, so here's Lauren Brown X. Do you believe that people should get pedicures, or do you view them as a potential health hazard?
Okay, so very great question. We get a lot of questions about going to the salon versus going to the podiatrist. If you have a medical issue, you need to see a medical professional. If you have fungal toenails, if you have a painful condition, if you have issues that make it difficult for you to wear shoes, then by all means, you need to see a podiatrist first before you can go to or return to going to nail salons. Now, if none of that is your issue, if your issue is cosmetic and you want to have your feet look great and all that stuff, that's fine. I have no problem with salon. My wife goes, my daughter goes. My mother goes. They're great if you go to the right place with good sanitary practices and you feel comfortable there. Salons are great, but they're not a replacement for medical treatment if you have a medical issue. Okay. I got to answer. I got to get May here. Sorry, May. Asked many times, even on Super Chat. A big dog stepped on her toe and since developed growth between my toes. I cut it out and it comes back. All right. So what you need to do, May, if you haven't already had it evaluated, is get an X-ray of your foot to see if, as a result of the big dog stepping on your toe, if there's been a bone injury of any type or the creation of a bone spur, which will cause a pressure point between your toes. Okay, if you get an injury here, say, and as a result, you get maybe some bone out of place, or over time you develop a bone spur. As you put your shoes on, if your toes will squeeze together, and that can cause pain. It can develop basically a corn, just like you see on top of the toe, but between the toes. So you should get that checked out by a podiatrist. You may need some x-rays to see what's going on. Some things you can do in the meanwhile, you can get toe spacers, whether it be silicone or foam or what have you, put between the toes. That will help with reducing the pressure between the toes there. So definitely get that checked out.
And we have Gregory Dingmax. He's shout out from Nassau, Bahamas. He says, I have a daughter, question about my 24-year-old daughter. She suffers from gout. What should she do to lessen the frequency of her attacks?
Well, gout, you know how gout works. Gout, a lot of the issues with gout have to deal with our diet. So there's a lot of information out there on gout. Again, that's going to be part of the learning series. So you'll see more from me on that. I don't want to spend a whole lot of time on the science behind gout. But gout, the issues can definitely be helped with diet. She needs to find out what her triggers are. There are some medications, particularly medications dealing with blood pressure. Lasix, for one, furosemide, is notorious for after a patient's been on that medication for a long time to develop gout. So figure out what the issue is, figure out what's causing it, and you can go from there.
Okay. And I forgot his name. I was just looking up his name, but he was asking about smoking in the feet. This really affects the feet. The smoking really affects the feet.
Okay. So I have a series on, actually a couple of patients that have done a series on the effects of smoking on their feet. And yes, smoking does affect the feet directly, not even indirectly, directly. Smoking affects the body, body-wide, skin to bone, head to toe, particularly when it comes to the cardiovascular system. So just like diabetes can cause circulatory issues, smoking can cause circulatory issues. Berger's disease is basically what we're talking about when we're talking about issues with the foot, where you get inflammation and clotting and shutting down the blood vessels to the foot, causing issues such as ulceration, skin color changes, nail changes, just like we see in our diabetics. So yes, smoking does cause issues with the feet. And every smoker, no. Most smokers, no. But it can definitely happen. That anti-smoking campaign that you see on TV from time to time now is showing a lady who had all of her toes amputated because she was a heavy smoker. So yes, smoking does play a role in foot issues.
Okay.
Mm-hmm.
If you're I don't want to make sure I get this name right.
Mm-hmm.
Escatar says, if your nails grow lifted, can it ever grow back normal?
If your nails grow lifted, that is the nail straight up off the surface of the nail bed. More than likely, that is a bone issue under the nail. If you have a bone spur or a lot of skin buildup underneath the nail, that's built up on the nail bed itself. The skin issues are easier to deal with. But if there is a bone issue, whether the bone on the tip of the toe is really curled up and is pushing up on the nail, or if there's a bone spur that's pushing up on the nail, so at times that will have to be shaved down if it's really a problem, especially if it's causing pain or difficulty wearing shoes. But those issues with the nails going up can be dealt with, yes.
Okay, Aaron, I know Aaron wants to know, she also gave a nice super chat.
Mm-hmm.
Donation. She asks, hi, Dr. J. Any tips for managing plantar fasciitis? Love your videos. And also, hello to Dr. Mrs. Jefferson.
Thank you very much, Aaron S. Again, plantar fasciitis, we're looking out for that subject in the learning series. Stretching, massage, ice, orthotics, heat, doing all these things in combination to deal with plantar fasciitis are definitely necessary. Again, there's no one thing, there's no magic bullet to help with plantar fasciitis. You have to do multiple modalities to help get rid of it. Properly wearing shoes, properly fitting shoes. Don't wear cheap, flexible shoes. Avoid flip-flops and sandals unless you have orthotic sandals to deal with this issue. You do these things in combination. You do them on a daily basis. Plantar fasciitis, unless it's really recalcitrant issue, most of the time goes away. But again, it's not going to just go away by magically. You got to put that work in. So doing those home therapy things help out a lot, but particularly the stretching, the massaging, ice, and the heat.
And Tristan Klein wants to know, she says, what is your scope of practice versus the orthopedic surgeon? I'm speaking specifically to your surgery aspects of your specialty. Okay. All
right, now, great question. Scope of practice, if you're not familiar with that terminology, scope of practice is what the state allows a physician or type of physician to do. So in DC and most states in the United States now, we're allowed to treat any condition of the lower extremity from the foot to the knee, not including the knee joint. So any foot issues, with the exception of vascular surgery. Vascular surgery, the scope of practice is for vascular surgeons. Or we can do anything else. Trauma surgery, course bunions, hammer toes, everything else that's foot related. I do a lot of wounds, not just of the foot, but of the ankle and the lower leg. We deal with skin issues of the foot, ankle, lower leg. We can fix ruptured Achilles tendons. We can fix ankle fractures, things like that. So scope of practice in DC, Maryland, Virginia, and a lot in most places in the country now allow a podiatrist to treat all the way up to the knee, not including the knee joint.
And we can take probably maybe two more questions.
Two more? Okay.
Yeah. But,
see if we can get different subject here.
So Sugar Doll.
Sugar Doll.
Wants to know, are there any shoes and socks that are made for people with neuropathy?
Yes, there are. And shoes for neuropathy and socks for neuropathy, especially in our diabetics, we prescribe shoes with softer linings, better insoles, better control to help protect the feet from injury. A lot of people with neuropathy can't feel pain, so they have to protect themselves from cuts, little rocks and glass that may get in the shoe, things like that, or any friction or pressure. So prescription shoes, therapeutic shoes, we call them, are definitely used in that situation. Socks are the same thing. We tend to use seamless socks in our diabetics with issues with circulation and or neuropathy, or other people who are non-diabetic who have these same problems. Seamless socks are great in this situation. If you have neuropathy, but you don't have diabetes, you can still get diabetic socks without seams. They won't have seam in the toe. They won't give a lot of pressure across the leg, so they work out great.
And Josh McGill wants to know, he says, love your videos, but what's your best advice for pod students?
As a pod student, hey, Wade, welcome to the family. Looking forward to you walking across that stage and joining us in this great work. Just do your research on how the practice is done. Talk to as many doctors as you can. Watch a lot of stuff on the internet. Develop your own philosophy. Everybody has a different philosophy for how they deliver healthcare. Always remember the needs of your patient supersede anything else. And be honest and true to your patients. Let them know what you can do. Let them know if you can't help them out, how you will help them out, or who you will send them to deal with their issues. Just be yourself. Be authentic. Enjoy your work. Make good relationships. Have a good rapport with your patients. While you're still a student, ask as many questions as you can. Have good relationships with your classmates, with your attendings, with your instructors, because all of your instructors will eventually be your colleagues. So make good relationships with them. Keep good ties with all your classmates, because you guys are going to spread out all over the country or all over the world, and you will need each other from time to time. You've made a great choice in choosing podiatry, and I'm looking forward to calling you a colleague.
Okay. And Brandy, she's one of your big fans on YouTube. She says, I have small knots on both Achilles tendons, and every time I step, I feel a click in both. How can this be fixed?
In the Achilles tendon. A knot in the Achilles tendon can be a precursor to a greater issue. So you definitely need to see a podiatrist to get that checked out. It sounds like you may need an MRI to see what's going on in that Achilles, whether there's been a tear or any other type of injury. Because if it continues, you can possibly get a complete rupture of the Achilles tendon, and that will require emergency surgery. Excuse me. So check that out. Get that checked out as soon as you can. You don't want Achilles tendon issues to go on to become major problems.
Okay, and I think that's it. You want to just close?
Okay, I want to thank you all for chiming in with a good turnout. I'm sorry we didn't have enough time to get to all the questions. Rewrite your questions if you'd like to, or I will go through all these later after this gets posted, and look for those answers. Again, you can reach out to me also on social media at DC Foot Doctor, most of the social media platforms, including TikTok. Your boy's on TikTok now. So I got one up. So I'm going to try to add that to the program, as well as Instagram, Facebook, and Twitter. Oh, and if you have a specific issue you want to talk to me privately, you can also reach me through telemedicine, and the telemedicine info is in the description of all my videos, how you can reach me and have a telemedicine consultation so we can talk about your issue specifically and privately. Again, thank you very much. This is always great. This is a lot of fun. Thank you for joining in, especially at a surprise Q&A. Usually the Q&As we publish them ahead of time, but we decided to try this format. So I will be seeing you guys soon. And again, thank you for supporting the channel. And most importantly, you know how I do. Take care of your feet. Peace out.